We're going to be talking about multiple sclerosis, a potentially disabling disease of the central nervous system, that is the brain and the spinal cord. When the immune system of the body attacks the fatty covering on the nerve, so I'm going to use the description of your wiring. Every wire has insulating rubber on the body. That insulating rubber on the body is called, for the body is called myelin sheath, and it's made of fat. So when this covering is attacked by the immune system, there's a lot of problems with nervous transmission and so many other symptoms can occur. These symptoms can vary from very mild to permanently disabling the person. The symptom can also depend on what area of the nerves have been affected, what part of the body is affected, and also how severe the attack is. What are the symptoms? Numbness. Numbness, that is on one part of the body, the person doesn't have any sensation of touch or pain or anything. Paresthesia, but it's explained as pins and needles. That is, you feel this pin sensation on one part of the body. There can be muscle weakness, there can be tremors, that is, the person has this lack of coordination. The person may not be able to walk properly, they may have problems with their gait. It can cause visual problems. It can cause problems with the sexual function, the bladder, and also the intestine. People like that may not have normal sexual arousal. They may have loss of libido. They may have bowel incontinence. They may have problems with passing urine. That is, they cannot control how and when they want to go to the toilet to pee. And such people, because of all these things, they can have depression because of societal problems and stigma. They can have dizziness, double vision. It can happen in one eye at a time or even switch between both eyes. These people are more likely to have worse symptoms when they're exposed to heat or hot environments. So people that are in the tropics have the symptoms worse than people that are in the temperate regions. Some people can have slurred speech. Some of them may even have to go through speech therapy to learn how to speak again. Some people may not have symptoms at all. It doesn't mean that disease is gone. It may mean that it's just a quiet period. So we have an interval where no symptom, nothing is going on, the person feels normal. It can last from between a few weeks to a few years. It's a sleeping period, doesn't mean the disease is gone. So what are those things, those factors that predispose people to have multiple sclerosis? Age. We notice that it occurs in people between the ages of 20 and 40 years. It affects women 3 times more than it affects men. People that have family members that have multiple sclerosis could also have it. People that have autoimmune diseases like thyroid diseases or diabetes could also have multiple sclerosis. It's noticed to be more in the whites, the North Americans, and African Americans, Africans, Asians, people from the other part of the world, Africans, are less likely to have the disease. People that stay in cold countries can have the disease more. That is, people that stay in temperate countries, while those that stay in the tropics are less likely to have the disease. People that are low in vitamin D, that is, people don't get enough sun exposure or don't take vitamin D supplements, have been noticed to have more risk of having multiple sclerosis. Of course, infection by the Epstein-Barr virus, the EBV virus, can predispose people to be more at risk of having multiple sclerosis. What are the complications of multiple sclerosis? Mood swings, paralysis. Imagine if the signals to the breathing muscles or the lungs cease. That means the person will have difficulty in breathing and can also lead to death. While some people can just have fatigue, muscle weakness. To date, there are no known treatments. The medications given and management models are aimed at helping the person in times of the attack, modifying the cause of the disease, and also helping to relieve symptoms. But research is still going on probable solutions. I hope I've been able to help with multiple sclerosis. Stay tuned. I'll see you on the next one.